So, what is your objective to mitigate this wellness to illness to wellness?
Thank you so much, Dr. Meher, and thank you so much, Assocham, for organizing such a great event. And I think the title is wonderful. If you all can imagine, illness to wellness means disease to health or disease to well-being. The concept is changing. Actually, there is a role of digitalization from illness to wellness. Means mostly healthcare system, especially healthcare delivery system across globally, they are working on curative care. Means if you are having disease, you are suffering from disease element, then you will go to doctor, they will do some tests, they will diagnose it, and you will treat it. But how we can get rid of disease? How we can be disease free? Then there is a role of prevention and prediction. And in prevention and predictive, there is a role of digitalization. Lot of role of digitalization. Illness to wellness means disease free, or how it can be healthy for lifelong or till your terminal stage, so that your operational efficiency of the body should be at maximum. That's why in Western countries, currently they are investing around 20 to 30% of their healthcare budget on preventive care or predictive care. In India, around 90%, more than 90% in developing countries, including India, we are allocating our budget to the curative care. That is the only treatment part. The government for last 10 years doing great job. They have started numerous wellness center, and now the government is also focusing on the prevention part or predictive part. If we talk about the role of digitalization in illness to wellness, there are lots of tools available right now in digitalization, and digitalization is not just a compiling your data and just storing in a computer or laptop, as Dr. Meher told. It is actually using technology so that your data can be captured, it can be stored, it can be utilized for better insight of healthcare problem, or better for use. It can be used for your diagnosis and treatment part. Not in diagnosis and treatment part. Now the digitalization scope has been increased so much that there are a lot of technology like AR, VR, artificial reality, virtual reality, augmented reality, virtual reality, AI, blockchain, and even the data analytics. They're all in Internet of Devices, IoT, and remote monitoring systems. They're all now the part of digitalization. And this is an ecosystem digitalization that is actually used for diagnosis, treatment, and prevention of the disease across globally, not in India. And now this industry is more than $500 billion globally right now, and growing at a rate of CAGR of 22%. If we talk about digital health only. Coming to the illness to wellness, now there are available AI tools, artificial intelligence tools, that will help in capturing data based on your chief complaint, current medical history, your past history, your disease profile, your body profile, your physical examination data, based on your family history, risk factors. All these can be captured, and based on all this data, it has been can be like analyzed that there is a prediction of developing such diseases in the future, and after 5 years or 10 years, and at that moment of time, there will be suggestion from that AI tool also that what lifestyle changes you require so that these diseases will not happen, or their severity will be less, or their incidence will be reduced. For that, this is known as predictive medicine. Second part is prevention medicine, preventive medicine. If you are having already risk factors, if you are prone to developing some diseases, then based on all this data, based on your past investigations, past history, everything based on risk factors, they can analyze and they can help in preventing disease also based on medical treatment, based on non-medical treatment, lifestyle changes. All these can be incorporated, and you can have a better quality of life without having disease. If you are having disease, because we know that doctor-patient ratio is quite poor across all the global countries, especially in developing countries, including India. Doctors are overburdened. I think Dr. Meher can tell what is happening to him in bigger hospitals. If AI tool can be incorporated in their HIS or their EMR, that is electronic medical record, then it will help in diagnosing the disease, planning for the treatment, execution for the treatment, and also then for the prognosis and outcome also. And it will reduce medical error also, or medical negligence also, because of if you are using all these tools, all these data insights in your electronic medical record. It will also help in patients for not carrying their lots of medical record to doctors, hospitals here and there. If we have interoperability, जैसे Dr. Madan बता रहे थे, if we have interoperability, but it is not fully utilized right now in most of the hospitals. But if we have inter and interoperability both in digital healthcare system, then everybody, all the stakeholders of healthcare ecosystem like patient, doctor, and hospital, they can have great access to their medical records. There will not be duplication of tests, diagnosis will be better, outcome will be better. So I think if we use all the tools, all the verticals of digitalization, it is not limited to only the capturing data and digitalizing in a software, but it has to be in an ecosystem like all the hospitals, as Dr. Meher and Dr. Madan told, like ABHA IV or ABBHM is one of the most ambitious project of Government of India. And I think this is only one sector, if we talk about health technology, where Government of India is ahead of private sector. 99% hospitals, they are not using actually digital health in their ecosystem. At Felix Hospital, we are one of the first hospital of India. That hospital is going for NABS for their digital health. We are using HIS, EMR, CRM, and teleconsultation, IoTs, and all that queue management system, appointment management system. So there are lots of verticals if we talk about in just digitalization of healthcare or hospital, and beside that, there are telemedicine. You can provide accessibility and affordability to the remotest area of the India for providing affordable healthcare services.
Thank you, Dr. Gupta.
Thank you.